lateral and the medial ligaments. Okay, so how do you do it? Again, you want to stabilize the proximal part of the ankle. In your hand, your grip's going to be a little bit different now. I need to hold on to the calcaneus and the talus, all right? But I'm going to provide a frontal plane stress now, all right? So I couldn't do that from here with this hand placement, right? I could pull anteriorly with this hand placement, but I wouldn't be able to provide a valgus or a varus stress test force from here, okay? So what you typically do is use these kind of three fingers, and you take hold of the calcaneus and the talus like this. Okay, so I have two fingers laterally here, and I have another finger, my thumb, on this side. Okay, just bend this leg for a second. Sort of like this. Okay, so that's what it looks like on the medial side. That's what it looks like on the lateral side. Okay, so I kind of have that calcaneus in my hand, and I have the talus underneath my fingers. Again, so I'd be kind of holding, okay, like this. So now certainly I'd be able to apply a varus, or a valgus, or a varus stress to that ankle. Okay? I'm really trying to take that talus and rock it in the mortise. Okay? It's a Talar tilt test. Right? Just like we talked about the knee, right? We talked about providing to get that knee to tilt. Right? It's the same thing we're doing, except it's a little bit harder to hold on to the talus and get to it, and then rock it in that mortise. So I stabilize here and here. I'll hold here and here. He's in slight plantar flexion. Okay? And if I want to apply a varus force, that means I want to gap the lateral side, right? So I apply most of the pressure with my thumb as I tilt that talus in there. Okay, now watch for a sec. That is a tilt. That is supination. See the difference? Okay, even if I'm stabilizing or not. That's a tilt of the talus in there. It's not going to move a lot, right? It's the most congruent joint in the body. This is not a Talar tilt. That's supination. That's a physiologic range. Everybody see the difference? Okay, so if I'm applying a varus force, most of my stress comes from my thumb, and I try to tilt that the talus and the calcaneus into varus. Okay, and if there was increased excursion or pain, it would mean that I've had injury to the ATFL or CFL. Right? I'm stressing the lateral collateral ligament complex. All right. If I want to apply a valgus force, I'm going to use my index and middle finger more. Okay, so I'll still stay stabilized here and here and hold him, and I will then apply a valgus force. Okay, and it's not, again, it doesn't move a lot, but it's not this. That's pronation. That's pronation. Okay, that's not a tilt that I'm looking for. I got to hold him in here, and I got to apply a lot of force that way, and sometimes it's uncomfortable. That little pinching on the side of your ankle. Okay, not the most fun you ever had. Okay. That's a valgus force. You see my force is sort of this way. Now I'm trying to take that talus and do this with it. All right? And again, now if I had pain or increased excursion, it would indicate injury to the medial or deltoid ligament. All right? The hardest part about this test is, again, a little bit of a hand plate, but also realizing this is a very congruent joint. It's very hard to get that talus to really rock in there. I mean, look at the shape of the mortise. It doesn't move much in there. Okay? So if you find it is moving, guess what? It hurt the ligament. Okay? And you can, again, always compare it to the other side. Most common mistake in doing this test, though, is doing this. You think that's a varus and you think that's a valgus. Okay? That's pronation and supination. Okay? You're moving the calcaneus into valgus and varus, but we need to move the talus. So try to keep it as a straight plane motion. There's my varus. Okay? There's my valgus. Okay? It doesn't move a lot. Right, but you make sure you have your hand placement in the right place.